Good afternoon, ladies and gentlemen, and thank you for tuning in for today's update, which marks 2 months and more since our first index case was reported. Here is the update on the situation in Guyana. The total number of confirmed cases of COVID-19 is now 57, inclusive of 6 deaths, with a total of 260 persons tested during the period 26th of February through the 16th of April 2020. 203 persons have tested negative and 9 persons have recovered thus far. 14 are in institutional quarantine and 42 in isolation. And there are 4 persons in our COVID-19 ICU. Of the 57 positive COVID-19 cases, 4 are known to have a travel history, and the other 53 persons contracted the coronavirus disease in Guyana. Our confirmed cases in region number 4 represent more than 80%, with most of those cases coming from Georgetown. To date, most of those who tested positive are males. In the over 50 age group, males and females are almost equally affected. However, in the 30 through 49 age group, most of those who tested positive are almost 4-to-1 when comparing males to females. Globally, according to WHO, there are 1,914,916 confirmed cases, with 123,010 deaths. In the region of the Americas, there are 673,361 confirmed cases, with 27,336 deaths. Our hotline continues to receive calls from concerned citizens, which total 2,066. And we thank you for these calls and wish to remind you to use the COVID-19 app as well as the hotline in your regions to seek information on this disease. Yesterday, Dr. Shamdeo Prasad, the Chief Medical Officer, spoke to you about those persons with underlying conditions that are at additional risk for developing the more complicated form of COVID-19. Let me remind you of those conditions. Chronic lung diseases, such as asthma and bronchitis, as well as those associated with smoking. High blood pressure and heart diseases. Diabetes or high blood sugar. And diseases associated with immune-compromised conditions, such as HIV, cancers, especially persons on treatment, lupus, among others. He also mentioned that in Guyana, there is a large group of persons as early as their mid-20s who have these conditions. Take note. I wish to appeal to all of you who fall in this group to take all precautions to prevent this disease. Further, if you had signs and symptoms of COVID-19, please do act promptly and seek medical assistance via our hotline, the COVID-19 app, and the nearest health facility. Allow me to introduce Dr. Alexander Harvey. Dr. Harvey, an anesthesiologist who is currently the Director of Medical Education at the Georgetown Public Hospital Corporation, who I have asked to talk to you about the care that is given to persons who have developed the more complicated form of COVID 19 and require ICU care.
Good afternoon. I'm Dr. Alexandra Harvey. I'm an anesthesiologist and Director of Medical Education at Georgetown Public Hospital Corporation. I've been asked to speak to you about ICU care, and give you an understanding and appreciation of what happens when patients are admitted to our ICU at GPHC. First of all, I would like to explain a bit about the types of patients that are admitted to our ICU. The ICU is reserved for patients who have more complex issues related to COVID-19. And as COVID-19 is basically a respiratory disease, the patients who are admitted are usually the ones who have serious respiratory complications. These complications, they manifest, they show themselves as being severe shortness of breath, worsening ability to breathe, worsening oxygen levels in their blood. When this happens, the patients can no longer be treated with the usual sort of care that they will get on an open ward. And so they will need ICU, intensive unit care. When the patient is admitted to the ICU, what can they expect? Once the patient is in severe, very severe distress, it is very possible that they will need a mechanical way of supporting their ventilation because they can no longer do it for themselves. It is at this point that they will need a mechanical ventilator, which is a machine that they will be attached to so that they can be given adequate oxygenation and support. In order to be attached to this machine, the doctors in the intensive care often need to intubate the patient. Intubation means that the doctors will pass a type of plastic tube into the patient's mouth and it will reach the lungs. The tube will then be attached to the ventilator so that added oxygen can get straight into the patient's lungs. Some patients will require this sort of support for a very short period and others for a longer period. During the time that the patient is in the ICU, especially when they are attached to a ventilator, they also need intensive monitoring. This monitoring is given by the nursing staff, the doctors who are in the ICU, and they are assisted by various machines that will monitor their different vital signs. These include the heart rate, the blood pressure, the heart rhythm, the level of oxygen in the blood. In addition, there will be other tests that have to be taken off and sent to a laboratory. And these are done quite frequently when a patient is in the intensive care unit. Now, not all patients in the intensive care unit will need to be attached to a ventilator. However, the patients who are there do need extra support for their breathing. They may be given oxygen masks of various types that are specifically made to give extra oxygen to patients. And therefore, patients may be asked to cooperate in the ICU so that they can get this added oxygen that does not come from a machine, but that they themselves have to help the added apparatus to work. The patients are often asked to cooperate in other ways by taking deep breaths, by assisting with turning. Sometimes they have to be put on their stomach instead of lying on their back, sometimes onto the side. But in COVID-19, often they are asked to lie on their stomach because this is what has been shown to improve oxygenation. When a patient is on the ventilator, there comes a time when the doctors feel that they have reached a point where they may be removed from the ventilator. This removal from the ventilator occurs when they are improving their oxygen levels and other aspects that we are monitoring. This removal from the ventilator is a process. Again, some patients will go through this process in a very short time, and others will take a longer time. The final removal from the ventilator is called extubation. There are many factors taken into account for the patient to be extubated. That is, the tube that is in their mouth going down into their lungs is now able to be removed, extubated. After the patient is extubated, they still cannot just leave the ICU because, as we say, that whole process is a process, and they may still have to wear an oxygen mask and added support for various periods of time. So patients in the ICU can run a spectrum from those who are breathing for themselves with added support to those who are attached to a ventilator where the ventilator is doing either all the breathing or some of the breathing for the patient. In our ICU, and for our ICU care at GPHC, we do try, as in the rest of the world, to not have to put a patient on a ventilator. However, if the time does come, we like to have adequate preparation time, which is why it is very important that patients do report to their healthcare facility very early so that we can monitor whether it is in a few days or a few hours to make a decision and to prepare to give them added support. I hope that this has given you some understanding and appreciation of what happens in the intensive care unit at Georgetown Public Hospital Corporation.
Thank you so much, Dr. Harvey, for that information. So, ladies and gentlemen, let us all play our part so we don't have to end up in the ICU with the ventilator. Let me remind you of a few things. If you must leave your home, remember to cover your nose and mouth. Wash your hands properly. Cough and sneeze into your elbows or a tissue that you must discard carefully. Most importantly, stay 6 feet apart from each other. Stay home, stay safe, and save lives. Let's stand together by not standing together, maintaining social distancing. Thank you. Until we meet again, God bless us all.